After you want everybody here, get your books out, because I don't know the head and neck. Know my abdomen and chest and upper arms very, very well. That's my forte.
I said,
Right.
Oh, I always have to sit next to me, jeez. Did you study the cranial nerves like one by one? Or by like section?
Okay, the skull foramens.
I watched a video on YouTube.
Right, the foramens of the skull. So we have the anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Right? The frontal crest, the lesser wing of sphenoid, the petrous part of temporal bone, foramen magnum. What do we have here in the anterior cranial fossa? Just two foramens, two of them. The first one is called foramen cecum. If you look at the atlas, you'll have foramen cecum, first one. And then we have the crista galli, actually midline crista galli, and cribriform plate of ethmoid. This foramen is called foramen cecum. What goes through this? Emissary vein that connects the nasal venous plexus with the superior sagittal sinus. You have veins in your nose, right? And that forms a plexus called nasal venous plexus. An emissary vein from here will go through the foramen cecum and connect with the superior sagittal sinus. And just behind that, you find the cribriform plate of ethmoid. And what goes through this? The olfactory nerves. How many olfactory nerves? How many olfactory nerves? About 18 to 20 on each side. 18 to 20 on each side. So if there is a blow, right? There's a blow to your forehead, this part, that could fracture this part of your anterior cranial fossa. And what you would see is bleeding through nose and loss of smell. Loss of smell is due to injury to the olfactory nerves. When the bleeding stops, you would see CSF discharge through nose. So when you have bleeding, it's blood mixed with CSF. So you can't really see the CSF. When the bleeding stops, you would see CSF discharge through nose. That's called CSF rhinorrhea, loss of smell. So where does this blood come from? The emissary vein that goes through foramen cecum, also from superior sagittal sinus. Now, if you break this part of the nose, you're going to bleed profusely because that's due to an area called the Little's area or Kesselbach's area, where there are 5 arteries that run to the house, which we'll see later. In this case, there will be no loss of smell. You can smell blood. You're bleeding, you can smell blood. In this case, a fracture here, there will be loss of smell, anosmia. So this is cribriform plate of ethmoid, foramen cecum, right? Then comes the optic canal. The optic canal is the first foramen in the middle cranial fossa. What goes through optic canal? Optic nerve and ophthalmic artery. You can read, good. Excellent. So ophthalmic artery. Ophthalmic artery is a branch of. Ophthalmic artery is a branch of. That is not there, unfortunately. Internal carotid. Internal carotid. It's good that you're looking at that picture and you're trying to identify structures. Really good. Okay. I'm not trying to make fun of anyone here because you're looking at the right picture. You're not looking at the wrong picture. You're not looking at the wrong picture, so I'm so happy. Okay, so it's optic canal. Optic nerve, ophthalmic artery. Then we have the superior orbital fissure. Right? Superior orbital fissure is this fissure that we have right next to the optic canal. What goes through superior orbital fissure? Yeah, read it. Oculomotor nerve Trochlear nerve.
Lacrimal, frontal.
Those are the branches of,
Trigeminal branch. One.
what's that?
Trigeminal.
Which is the ophthalmic division of trigeminal. Then, abducent nerve. Then, that's it.
Superior ophthalmic vein.
Excellent. Superior ophthalmic veins. So we have oculomotor nerve 3, trochlear 4, ophthalmic part of 5, 6, which is abducent. Then we have the superior ophthalmic veins. They all go through this foramen, superior orbital fissure. So if I use that foramen for your lab exam, right? Insert a probe into that foramen, ask you to name the blood vessel that runs through it. Just name the blood vessel that runs through it. Superior ophthalmic vein, right? So 3, 4, part of 5, 6, and a vein. 3, 4, part of 5, and 6, and then a vein, superior ophthalmic vein. Then we have foramen rotundum. What goes to foramen rotundum?
Maxillary branch of the trigeminal.
Maxillary division of the trigeminal nerve, right? Then we have foramen ovale and foramen spinosum. Foramen ovale, what goes to foramen ovale? Mandibular division of trigeminal nerve. What else do you have in that picture? Ovale.
The accessory meningeal artery
Accessory middle meningeal artery, right? Then,
and the lesser protrusal.
and there's one more that's missing. What is it?
Emissary vein.
Emissary vein that connects the pterygoid venous plexus with the cavernous sinus. It's meal or male, right? I told you MEAL or MALE. M is mandibular nerve, E is emissary vein, A is accessory middle meningeal artery, L is lesser petrosal nerve. What is lesser petrosal nerve? What is lesser petrosal nerve?
Branch of the facial nerve.
Lesser petrosal nerve. What does it do? It carries parasympathetic fibers from glossopharyngeal nerve to the otic ganglion, which is going to supply the parotid gland. Remember that? Glossopharyngeal nerve gives the tympanic branch, which goes into middle ear, forms the tympanic plexus, from which arises the lesser petrosal nerve, which exits the skull through foramen ovale and joins otic ganglion. So that's foramen ovale. Foramen spinosum, what goes through this? Foramen spinosum,
Middle meningeal artery.
artery and vein and
Meningeal branch of the mandibular nerve.
which is also known as nervus spinosus. Remember that in class I told you, the artery that creates the headache and the nerve that carries it, they go through the same foramen. Middle meningeal artery is the one that when it pulsates, it results in headache, and the nerve that carries it is the nervus spinosus, which is a meningeal branch of mandibular division of trigeminal nerve that goes through the same foramen. So, the most important thing that runs through this foramen spinosum, is the middle meningeal artery. Then we have foramen lacerum, right? It's a very big lacerated foramen. What goes through this? Foramen lacerum. What do you have in that picture?
Greater petrosal.
Greater petrosal nerve and that's it. Internal carotid artery. Internal carotid artery enters your middle cranial fossa through foramen lacerum. A lot of textbooks wouldn't mention this. You know, if I have a real skull, I can show you this. These are all plastic models. Carotid canal, what you can see from below, it enters the foramen lacerum. It ends in foramen lacerum. So internal carotid artery from here will go through carotid canal and then enter the middle cranial fossa through foramen lacerum. So foramen lacerum, the largest structure is internal carotid artery. And then greater petrosal nerve. What is greater petrosal nerve? Anyone?
Is that a branch of the facial nerve?
Excellent. Let's go to facial nerve. What is it going to form? It is going to join with something and then form a nerve,
Vidians.
the Vidian's nerve, right? And it's going to end in which ganglion?
Pituitary.
So you got palatal ganglia, it's going to supply
lacrimal.
the lacrimal gland. Okay, then when you come into the posterior cranial fossa, the first thing you see is the internal acoustic meatus. Internal acoustic meatus. What runs through the internal acoustic meatus?
7, 8, facial nerve.
7, 8. What do you have in between? Do you have a nervus intermedius? Do you have it in the list? What happened? You can't read now?
Get a vaccine.
What is it? What are structures?
Facial, vestibular, cochlear, and labyrinthine artery.
Some books would even include a separate nerve called nervus intermedius, which is nothing but the parasympathetic part of facial nerve. At that point, it is separate. It then joins facial nerve. So if you ever come across a nerve called nervus intermedius, that nerve is nothing but the parasympathetic part of facial nerve. It emerges separately from the brainstem. It will run with facial nerve to some extent and then will fuse with the facial nerve. At some point, they even considered calling it a different nerve. Then we would have 13 cranial nerves, right? Then they said, no, let's just call it nervus intermedius in between. Okay, so facial nerve, vestibulocochlear nerve, and labyrinthine branch of the basilar artery. Okay, they go through this. And then we have the jugular foramen. What goes through the jugular foramen? 9, 10, 11, right? Glossopharyngeal vagus accessory. What else do we have? Internal jugular vein or the sigmoid sinus. What's given there in the list?
The sigmoid sinus and the posterior meningeal artery.
Okay, sigmoid sinus. Because the reason I said internal jugular vein or sigmoid sinus is because sigmoid sinus continues as internal jugular vein. So at that point, it's exactly at that point, above this point is sigmoid sinus, below this point is internal jugular vein. So some books will say internal jugular, some would say sigmoid sinus. And the posterior meningeal artery, right? Is there a superior petrosal sinus?
There's an inferior.
Okay, inferior is there. Superior also goes into it, but it's okay. The most important thing you should remember for the jugular foramen is 9, 10, 11. 9, 10, 11, sigmoid sinus. Glossopharyngeal vagus accessory and interjugular. Finally, here we have the anterior condylar canal or the hypoglossal canal. And what goes through this? Hypoglossal nerve. Anterior condylar canal or hypoglossal canal. And then the last one, foramen magnum. What goes through foramen magnum? The lower end of medulla, right? With the meninges, vertebral arteries, vertebral venous plexuses, tectorial membrane, apical ligament of dens, the tonsil of cerebellum, right? There's some more. Okay? The most important thing you should remember is the lower end of medulla. Right? Exactly at this point, medulla ends, spinal cord begins. Right? So lower end of medulla, with all the 3 layers of meninges, vertebral arteries, which you have in that list, right? I'm sure. Vertebral venous plexuses. Do you have it? No? Okay. Spinal accessory nerve. Spinal accessory nerve. Do you have it? Okay. Then tectorial membrane. Tectorial membrane. Apical ligament of dens. And what I miss? Tonsil of cerebellum. Tonsils. They slightly protrude through that. And there are actually many other structures which are not that important. So those are structures going through foramen magnum. So it's really easy to look at these foramens and identify structures because if you go from the front to the back, 1, 2, 3, 4 side, the last one, 12th. So here is 1, 2, 3, 4, 6, part of 5, again a part of 5, maxillary part, again a part of 5, mandibular part. We finished 6 here. So what's next? 7 and 8, then 9, 10, 11, then 12. Right? Cribriform plate of ethmoid, number 1. Optic canal, number 2. Superior orbital fissure, 3, 4. Ophthalmic part of 5, then 6. Rotundum, maxillary part of 5. Ovale, mandibular part of 5. Right? Then you come to posterior cranial fossa, 7 and 8. Internal acoustic meatus. jugular foramen, 9, 10, 11. The anterior condylar canal, 12. Is that difficult? Not really, right? You just go from anterior to posterior, you can number. Now to simplify this further, which cranial nerve is present in the anterior cranial fossa? Just one. Middle cranial fossa, 2 to 6, right? 2 to 6. Posterior cranial fossa, 7 to 12. And this is really important to remember. If a patient has a fracture of base of skull and only cranial nerves between 2 to 6 are affected, then you know the fracture is in the middle cranial fossa. If it is cranial nerves that show symptoms between 7 to 12, then the fracture is in the posterior cranial fossa. If the patient is just showing anosmia, everything else is fine, the fracture is in the anterior cranial fossa. At least you can localize, right? I know there's something wrong, but I can say definitely it's in the middle or anterior or posterior cranial fossa. Okay? So, where did you get that list from? The list that you have?
From our lecture,
Okay.
the Blackboard.
Okay. So just look at that, make a table. It's really easy, it's not that difficult. So we'll try to identify all the foramens and all the skulls. If you have any difficulty, I'll come and help you.
There's a couple things listed on the picture that say inconstant. Is that just something we don't need
Which
to
one?
change?
Which one?
Condylar canal,
Posterior?
mastoid foramen, and sphenoidal emissary foramen.
Or they're really small foramen. They're not really inconstant, you'll find them, but they're really extremely small. Like the sphenoidal emissary foramen, it's for emissary vein. Extremely small emissary vein that runs through this, connecting the pharyngeal plexus with cavernous sinus. And the mastoid foramen is always present, again for emissary vein. The last one you said condylar canal is probably the posterior one. The posterior condylar canal also transmits an emissary vein that connects with suboccipital venous plexus. Here at the back we have a suboccipital venous plexus that connects with the transverse sinus. So an infection here, the back of your neck, can go to the transverse sinus. Okay, so all the three foramen that you mentioned, they're all for emissary veins. Again, there are a lot of foramens in skull, lots of foramens in skull. And there are a lot of canals within these bones that you can't see. You have to disarticulate these bones to look at structures. And if you try to separate these bones, all the 22 bones, you'll find canals within the bones that you can't see from the outside. Just this bone, the temporal bone. I can talk about temporal bone for 2 hours. There's so much information about temporal bone. It has many canals within it. A lot of nerves run through that. But we can't, it's a plastic thing. The real skull, you try to separate the bones, then you find all of this. How do we separate bones? In a skull. Without breaking them. Any idea?
Along the suture line?
No, sutures are fused. At least partially. We have a very simple technique that we use always to separate the skull bones. Fill the skull with some kind of, bean, something that would sprout, right? Fill it, soak it, add a lot of cotton to it, just leave it. When they sprout, when they start to grow, they'll separate all the bones. And you'll find all the bones, clearly separated, take each one of them, collect them, identify them. If you try to break it manually, it's difficult. You'll end up breaking bones. It's that easy, but now we people always, we're educated people, we try to think about all the different techniques that we can use. Go to a layman, he'll tell you, simple. Want to break anything? Even a big rock, want to break it? A germinating seed will break it, right? Just put something in, let it grow, it'll break it. Yeah, so that's how we separate them. And I have a lot of skulls that are separated, not here, I can't bring them here. They're back in India at home. But you can look at all those bones. There are canals. If you pass a flexible probe, then you can see the thing coming out. Like I said, the maxillary artery runs into the pterygopalatine fossa and comes out through the infraorbital foramen. If you have real skull, you can actually pass those probes. It will come out. You can see it. Anyway, so these are the foramens we need to know. All the foramens in the face, right? If you know the name of the foramen, you know the structure that goes through it. But they're all named similar to the foramen. Supraorbital foramen, supraorbital nerve vessels. infraorbital foramen, infraorbital lemon vessels, mental foramen, zygomatic-facial foramen. All these foramens, right, in the face, whatever is the name of the foramen, the structures that go through have the same name. When you flip the skull, you'll find a stylomastoid foramen through which the facial nerve comes out. Right? You see a depression there. Between styloid process and mastoid process. Stylomastoid foramen. It is through this foramen facial nerve comes out. Okay, let's try to identify all the structures.